Hi, I'm Matteo Galderisi. I'm a physiotherapist and expert for Medisport. Today I'm going to talk to you about Cryo-Ultrasound. Cryo-Ultrasound is a medical device. It was developed in 1989. It's been used for over 30 years. We have it now in more than 30 countries, and it's used worldwide for its incredible characteristics. You will find on the internet, of course, specific reference and scientific studies. We have on PubMed single-blind, double-blind studies, which certifies the utility and the characteristics, of this powerful device. But today I'm going to talk to you about my experience with it, because of course you can find all you want on the internet, but I've been using this device for a lot of years in very great variety of situations, and I will explain how to gain the best out of this and how to use it properly in sport, in orthopedics, in traumatology, rheumatology, and in a very great variety of patients. Cryo-Ultrasound was founded in 1989 by an idea of our client and important physiotherapist, and then developed in 30 years by Medisport. We now have the 4th edition of this device. This is the latest and newest, and is used, as I said, worldwide. We have it in sports team, professional sports team, so in Italian Serie A, in French Ligue 1, in the English Premier League, in Emirates, in the Arabs, in the Asia, really worldwide, and it's really powerful characteristics. Today I'm going to talk you how to use it, as I said. Cryo-Ultrasound is based on the technology of course, ultrasound and cryotherapy. And you have the use and the union of these two power technologies that you can use with your patients for its incredible anti-inflammatory effect and analgesic effect, of course. As well, you have 3 devices in one, we can say, because we have cryotherapy, we have, of course, the ultrasound, and we have the combination of cryotherapy plus ultrasound, which is, of course, I think, and you will see, the most powerful one, the combination of the effect of the two. Because you have the analgesic effect that, of course, cryotherapy gives you, and then the anti-inflammatory effect that you can reach with ultrasound alone. But you will see today how to gain the best, to have the more powerful effects with the union of these two effects together. Okay. So as I said, we have an ultrasound. The power of the ultrasound reaches a maximum of 3 watts per centimeter square, while the cryotherapy can go from plus 10 degrees Celsius to minus 10 degrees Celsius. Why we combined 2 therapy, maybe we can say a little different, like ultrasound and cryotherapy, because you know that cryotherapy, of course, has benefits for analgesic effect because of the cold and the ice, and ultrasound otherwise has thermal effect. So maybe a little bit the opposite, okay? But we combine that to use the ultrasound at a full power. This device only offers you the possibility to use the ultrasound at a maximum power of 3 watts per centimeter square in really nearly every condition that you will find in your practice. So both in sport, also in your clinic, in a hospital, and with every patient that you can find, you can use the maximum power of ultrasound, and you will not be able to do that and to use that at the maximum power without the interaction of the cryotherapy, of course. So why we use it together? Because the cryotherapy gives you a nice cone. So you have to imagine, then we will see with the patient later, we will do a demonstration. But you have to imagine that with this device, you have a nice cone that goes really deep into the tissues. So we gain 7 to 8 centimeters depth. It's really a lot. So you can reach nearly every tissue of the body. And this ice cone prevents you from the thermal effects of the ultrasound alone. So also in maybe acute stages, if you work with sport people and athletes, and you will not use an ultrasound. If you think about it, if a sport player gets an injury and comes to your clinic, you will not use your ultrasound of course, on the first day or on the second day because of the thermal effect. You know, you have to do maybe a little of 3-4 days with ice packs, etc., and you will not treat them. With this one, you can use it and treat it right in the first day of the injury because you have the cryotherapy that protects you and allows you to do the ultrasound, because the thermal effects will not be important. You have a nice cone of the cryotherapy that, of course, prevents you. So you can use really high powers, and then we'll see the differentiation between acute and chronic stage of pathology. But you can use ultrasound at high powers and with the help of cryotherapy. Okay, we talked about the general characteristics of Cryo-Ultrasound. Now we go a little bit deeper. We see the details of this device. Cryo-Ultrasound is composed by this headpiece. This is maybe the most important part of all the device, and now I explain you why. In the previous devices, we have the thermic exchange directly into the machine. So we had a compressor here for the thermic exchange to reach, as I said to you, minus 10 degrees Celsius, which is a very low temperature. What can happen in the devices that have the compressor right here? You can lose a little bit of the temperature you reach in the way up to the headpiece. So you will lose a little bit. Maybe you set -4, -5 degrees Celsius, and really you don't have it right here. Maybe you lose 2, 3, 4 degrees. And the temperature may not stand still in all the time. So you don't have it, let's say, for 10 to 15 minutes, you don't have the temperature you set. How of course, we change this? This is the first device that has the thermal exchange right here, right in the headpiece. So, of course, you will have the temperature that you set, you will have it right here. So if you set -5, -4, 0, up to 10 degrees, you will have it right here and right on your patient without losing it for all the time of the application. So for 10, 15 minutes, you have the same amount of energy and the same temperature required. This is a very, very, very important thing, and it's, I would say, a unique characteristics of this device only. So, of course, this comes with maybe a little problem. The headpiece can be a little bit heavy, and as you see, the pipe, the conductive pipe, are a little bit big, and of course you can have problems. We know that based on our experience, some therapists complained about problems with the weight of the head. So how did we solve it? Because of course, as I said to you before, this device has been developed since 1989. So in over 30 years, of course, we added some things, some accessories that helps the therapist working better. In this case, we see these two accessories here. We have this one, maybe the most easy, you know. It's a bit easy. It's just a support rod, a shaft, very flexible, as you can see, and it helps you in the dynamic treatment. So if you have to treat in movement with the ultrasound, of course you know already that with ultrasound you can use in movement or without movement. We of course know that the best maybe way to do the ultrasound is always in movement. But if you find when you treat, and then we will see in the demonstration, but if you find when you treat that the head is a little bit uncomfortable, you can use this. Very, very, very easy. It just helps you to stabilize the weight, and as you can see, with only 2 fingers, I can do my therapy, of course, when the patient is here on my bed, and I can really lift without any effort. So this takes off a little bit of the weight of the headpiece. You will not have to do a lot of force with your arms because you have this. It's very flexible, you don't have to worry. So you just place it here and you work really, really easy. The second one, this little arm here, is for the other option of treatment, which is the non-movement option. So when you fix the headpiece on the patient, why do we use it? We can use it, of course, with little parts. Maybe you're treating epicondylitis, maybe you're treating pulleys, so a tendon. It's a very little piece, and you of course you don't have to do big movements on the part. You just have to stabilize the headpiece on the body part that you choose. So how you use it? It's really easy. This one too. You just set the headpiece into the support. You just fix it, and then you can adjust, of course, height and length. You can do whatever you want. Of course, then you will see in the practical demonstration a little bit better. But what else does it change? We change the support. So we use the little shaft here for the dynamic treatment and the arm here for the non-movement treatment. But we also changes the characteristics of the ultrasound. So we will use maybe high powers for the dynamic treatment and low powers for the non-movement treatment. This is a little bit, maybe you know already, you already know how to treat with ultrasound. Then we will see better in practice. But the important thing is that this allows you to work without any fatigue, without any stress to your arms, to your shoulders, and to work really, really easy in both situations. Okay? Okay, now we talked about the general characteristics, and let's go deep. So now I'll show you a little bit of practice, and before see the use with the patient, we will see the display of the device and how to set properly the device. You will see that it's very, very, very easy to set, but it's important to set it properly to have the best performance out of this. Okay, so let's see the main characteristics of this menu. We'll have the power. As I told you before, we can go from 0 up to 3 watts per centimeter square. This is the maximum power. We have, with this ultrasound, a frequency of 1 megahertz, so it guarantees you, it allows you to go really, really deep in tissues. As I told you before, 7 to up to 8 centimeters in depth. This is very, very important for the power and for the depth of the ultrasound. So we see these 4 items here. We have mode that refers to the ultrasound applications. We had the cryo that refers, of course, to the cryotherapy, to the temperature and time. And then we'll see the menu, of course. So mode. When we get into the mode, we have 3 ultrasound modalities. We have a continuous emission, we have a pellicular emission, and we have a syncopated emission. I will explain later what are the differences, and we'll see in the practice, but now I anticipate something. Of course, for the continuous emission, you use it with a more chronic aspect of the pathology. So if you have the same pathology with the continuous emission, you tend to use it more in a chronic phase, while in the acute and subacute phase, you will use pellicular or syncopated. Of course, these that I give you are my advice. They are based on my experience. As you will see, you have to maybe build a little bit your experience with Cryo-Ultrasound. This is not a law. These are just advices. And of course, you can change it with your experience and your, of course, abilities. So we'll see later how the difference with these 3 modalities. And then we go to the second aspect, the cryotherapy. So let's see, let's make an example with a chronic patient. A chronic patient, I will set a continuous emission. Okay, so I press OK and I go to the second item, which of course is the cryotherapy. As I told you before, we can go from minus 10 degrees, and then you can see this is the maximum power of cryotherapy, up to plus 10 degrees. This is very, very important because this allows you to treat a great variety of pathologies. Okay, so let's see, even in this case, it changes a little bit if I have a chronic or an acute phase of the pathology. If we have a chronic phase, of course, I can use a low grade of cryotherapy, but the most important thing is if I'm doing my therapy in movement, of course, I can set the temperature a bit low. So from 0 and down, -1, -2. In my experience, I use it up to -5, -4 degrees. That depends, of course, on the patient, on the muscle of the patient, and the skin, the depth of the skin of the patient, the amount also of fat under the skin. And if I'm saying I have a chronic pathology, maybe I set to -1, -2. But if I have to treat my patient in a very, very small body part, and I don't have to use movement with my headpiece, I can set the temperature, of course, a little bit higher because I don't want to harm my patient. So I can set it, in this case, higher to 3, 4. There are cases of physiotherapists that works with us that use this in non-movement therapies, the cryotherapy at 10 degrees, which is a high level, but it works. It works. And if it works for you and for your patient, it's good. Of course, the advice is if you have to move the headpiece to set it a little bit low. So let's see, this is 0. Let's go a little bit below and let's say -1. Okay. Then the third, time. Time is a very, very important variable. In the oldest devices, we had to set the time really, really high because the device took a lot of time to reach the set temperature. So now I set -1, and of course it will take forever to reach -1 degrees. In this new cryo-ultrasound, we can reach the temperature, the set temperature, in only 1, maximum 2 minutes. So it's very, very fast. The application lasts from 10 up to 15 minutes. It, of course, also depends on your experience, but you can set your time. If you're gonna do, let's say a 15 minutes application, you can set it just 17 minutes to be sure to have a couple of minutes to let the temperature go down and that your patient feels good. It doesn't feel any discomfort for the temperature to be too cold. And he had time, so he has time to take your temperature at -1, which is really, really cold. So you set just a couple of minutes more of what you choose, and this is really, really easy. So let's see that. Okay, the menu we'll see later. The menu. Let's see. So I have this chronic patient. I set continuous emission. I set -1 Celsius degrees for the cryotherapy. I set 17 minutes because I want to do a 15 minutes therapy. If I go up and press start, it will not actually start the therapy. Why? Because I left here, you can see, the power at maximum. So it will be very dangerous for the patient to start at 3 watts per centimeter square. So the device has a protection and it doesn't allow me to do that. To do that, I have to first take the power to 0, as you see. And now when I press start, you hear the sound as you turn up the device. So now I can rise up my power and go, let's say if I have a chronic disease, of course I can go a little bit higher. So even 3 watts per centimeter square, 2.5, okay? If I have an acute or subacute pathology, maybe I will go a little bit lower, but don't forget that you have, of course, the cryotherapy that protects you. So you can go even a little bit higher in acute pathology. You will not do that with a normal ultrasound, but you have cryo-ultrasound and you can do that. And the ice cone, as I told you before, protects you. So you can go really high with the power of the ultrasound and you don't cause any problem or discomfort to your patient. Of course, especially when setting the temperature, the most important thing is to have the feedback of your patient, because you always want to ask your patient, especially if you're setting the temperature below the level, the zero level, you always have to ask the patient how he's feeling, he has any discomfort, okay? So you're sure that you don't cause problem. As you can see, here we have the time of the application, and here we have the temperature that the headpiece is reaching. So as time passes, as you can see, temperature already is at 10 degrees. And as I told you before, now it's 9. And as I told you before, in a couple minutes, you will reach your set temperature of -1 degree Celsius. As I'm speaking, as you can see, we have at 100 seconds, and we already are at 4 degrees. If we wait another couple of seconds, we will be at the set temperature. So really, really fast to reach the temperature you set. And this allows you to be fast and does not require 20-25 minutes as it was in the past to set the temperature. Here, as I was speaking, 2 minutes, and we have the temperature desired. So now we take a look at the 3 different modalities of ultrasound. With the use of a little bit of alcohol, we will see the cavitation effect. So now we see the 3 modalities. The syncopated modality, you can use it in the acute stage of the pathology, in the very, very early days, even in the first day of injury. So player comes to your clinic, first day of injury, you can use it with syncopated emission, and you set OK. As I said, syncopated. You don't have to set the temperature in this case. You just press start, and as you rise up, you see the emission syncopated. So we have a time of emission and a time of pause. This guarantees you to don't have, it doesn't have, of course, big thermal effects, okay? Because great pauses, and you can use it even in very, very, very acute stages. Second one we're going to look at is the pellicular, which is for the subacute stage of the pathology. So we press OK, press start, and as you can see, as I raise up the power, the syncopated emission is nearly continuous. It has paused, but it's really different from the syncopated one. And now we see the difference between this and the continuous emission. The continuous emission, of course, is better used in chronic pathologies. So you will see maybe 7 days, 8 days after the injury. We select the continuous, and we make therapy start. As you can see, continuous emission doesn't have pauses. So of course, if you use it with your patient, it better be not in the first days. Of course, you have the cryotherapy that protects you, but you can set, as I said, the syncopated emission for the first days, then the pellicular mode for the mid part, so subacute, and continuous emission for the chronic stage of your pathology. Last thing, let's get into the menu. Okay, so here you find the setup, mode, pathologies, regulations. Let's see quickly. In the setup, you can change date and time or the language. We have the mode, so to choose of modality. The most important thing is pathology. In this category, you can find the preset advices that we give you for each pathology. So you can, of course, adjust it to your experience and to your knowledge. But if you don't know how to use it, maybe it's the first days that you're using Cryo-Ultrasound, you can choose the pathology, let's say in the lower body. You have bursitis, let's say pubic bone, tibial muscle. Let's say we have a bursitis. We can choose if you want a static or dynamic treatment. This is, of course, your choice. Maybe it's a shoulder bursitis, so we want to do dynamic and go around the shoulder. And here you find the advice. We want to treat the bursitis at 2 Watt per centimeter square in a continuous mode, reaching -2 degrees of temperature for a time of 15 minutes. Of course, you can change all of this if you want to. If you find better at -3, at 0 degrees, you can decide all you want. But if you don't know at first how to start with this device, you can see here our advice. You press OK, and you go into the menu with the characteristics that we gave you for each pathology. You just have to set the power. So if you set 2 watts per centimeter square, as we told you, you just have to take it to 0, then you press start, and when you turn it up, you go up to 2 if you want to follow our advice, or you set at the power, at the energy that you prefer. And here the therapy just started, so with really a few clicks on the button, you just have the preset for pathology. Okay, now we're going to take a look at some practical application. We're going to start with the shoulder complex, and in this case we have a frozen shoulder in our patient, and we will see how we can treat frozen shoulder with Cryo-Ultrasound. Of course, we assume that frozen shoulder is a chronic pathology, so we are in a chronic stage of the pathology, and so we will set, as we said before, we set the modality of the ultrasound. We can set it continuous emission, because we want to move the headpiece while we're walking, so it's okay to set the continuous. We will set the cryotherapy. As we spoke before, the cryotherapy in this case, for a chronic case, can go from 0 to 2, even below the level of 0. In this case, maybe we will set temperature between 0 and 2 degrees. So let's say 1 degree. So we stay in the middle. Of course, you can change all these parameters by your experience with the patient. And then time, as we said before, the time, we usually stay between 10 and 15 minutes. So in this case, we add always 2 minutes to allow the device to reach the set temperature. So I go to 17 minutes, and it's okay. Last thing we want to set is the power. So as we said, the ultrasound can go from 0 to 3 watts per centimeter square. It depends on a lot of factors, on the deep, how deep you want to go with the ultrasound, on the patient. With the cryotherapy also, the thickness of the skin of the patient. So you have to assess the patient, of course. You have to assess, you have to consider all these parameters, also the age of the patient, and then you decide these parameters. We give you a little advice. Of course, you can change it based on your experience. In this case, I would set the maximum of the power, 3 watts per centimeter square. This is because I have a good temperature. I set 1 degree, so the cold, the ice, will protect my patient from the 3 watts per centimeter square, and I can always lower it down a little bit if I have to. Okay, so before starting, this is of course, the headpiece that we said before. We use Cryo-Ultrasound with the conductive cream. Why don't we use the gel, the water gel, like an ultrasound, a normal ultrasound? Because the water gel tends to freeze, because it has a water composition, and I will show you. So this is a normal water gel that you usually use with ultrasound. We use this with the normal ultrasound, but it's composed mainly by water. It is a water solution, so it will freeze when you set the temperature around the 0 degrees or below. And you will not use it, because if you have a long application, let's say 15 to 17, like in this case, 17 minutes, you will freeze the gel. It will be a good discomfort for the patient, and you will not be able to drag properly the headpiece, okay? So we use this cream. This doesn't contain paraffin, so it's also a very direct transfer of the temperature that you're setting. Is conductive, so your cryotherapy, the cryotherapy that you're setting really goes into and deep into the patient. We want to have approximately 1 millimeter of cream between the headpiece and the part that we're treating, and we can start. Okay, so as I said here, as I told before, we have to put the power down, and then we start. You hear the beep, so the therapy starts. I set it at maximum, 3 watts per centimeter square, 17 minutes, 1 degree. I can use the shaft, as I said before, or I can place it on my shoulder. In this case, the patient is high because he's sitting on the bed, so I will place it on my shoulder. It's a bit more comfortable. Of course, you can find your own solution. When the patient is lying, maybe it's better to use the shaft, and in this case the patient is sitting, maybe it's a little bit more comfortable. So you can apply on the applicator and on the patient as well. If it's not enough, of course, you can add directly on the patient. The important thing is that you're moving. So in this case, you will set the headpiece in this way. It's really light. In this way, you really don't make any effort. In the application of the therapy, you have to make these small circle movements, and very slow, because you want to penetrate. Okay, so we start in this case with the cream applied on the shoulder. Make sure there's a good contact between the headpiece and the skin of the patient. Do you feel the ultrasound a little bit?
Yes.
Yeah, too much? Okay. So if the patient is feeling too much the ultrasound, the power, because we set really high, we can lower it down a little bit. So just by turning, and we can go to 2.5, 2.6 watts per centimeter square. Is it working? It's okay now? Okay?
Yes.
Okay. So always check the patient, both for the ultrasound and the cryotherapy. So you want to check for the intensity and for the temperature, of course. Always have the feedback of the patient. Now he's feeling that the temperature is going down. And of course, as you know, for a frozen shoulder, we have to treat all the joint capsule. So we go in this part of the shoulder, up, and then backwards. The important thing is always with these small circle movements, very, very slow. We're not rushing. The temperature now is really, really good. It's 1 degree, as I said, so it's already the temperature I set, and I can feel it very cold. And this is my treatment. Okay, now we're going to take a look at an acute situation or subacute. It depends, of course, when the patient comes to your clinic. We're going to see a rotator cuff problem. As you know, the rotator cuff is formed by 4 muscles. The most important, more often injured, is the supraspinatus. So you know the supraspinatus runs here from the scapula and attaches here in the rotator cuff. And in the treatment, we can really treat the tendon and the muscle. And of course, we can do the same thing with the other muscles here in the scapula and the common tendon in the shoulder. So as before, we set the parameters. In this case, because it's an acute or subacute phase, we will use it not in a continuous modality, but in a pellicular or syncopated. It depends on the days. So if you're seeing the patient in the first day of injury, maybe you want to use a syncopated. We said it before. In the first 2 to 3 days, 4 days, you use syncopated to guarantee the patient that he will not have discomfort for the thermal effect of the ultrasound. So in this case, we're selecting syncopated mode, and we're setting the cryo. We have to consider, of course, the thickness of the skin and the muscle that the patient has. So in this case, you can see that you know that the tendon runs under the deltoid muscle, so we can use a little bit of power with the Cryo-Ultrasound, but in the scapula, in the shoulder blade, we don't have as many muscles. We don't have a lot of skin. So maybe when I run from here to there, we can change a little bit the parameters. In this case, for the cryotherapy, I will set 1 degree. Setting the time, so as we said before, in this case we're choosing a 15 minutes treatment, so we always add 2 minutes when setting, and we're putting 70 minutes. Okay. After setting all the parameters, we can press start. You hear the beep when the therapy is starting. As we said before, I can always start with a good amount of energy for the ultrasound. Also 3 watts. You know, it's not a problem because, of course, you have the cryotherapy that protects you, as we said before. So we can really push with the amount of watts. And you cannot do it with an actual ultrasound, with a regular ultrasound. You can only do it with CryoUltrasound because you have the cryotherapy. So in this case, I always put in this way the device, so I'm comfortable and I don't feel the weight of the headpiece. And we can start maybe here in front or here. And you know that in a problem of the rotator cuff, the patient may have discomfort in the abduction or inflection. So we can ask the patient, when we are treating the muscle here, to perform a little bit the movement that are causing discomfort. This is because, in this case, you will feel the analgesic effect of cryotherapy, and you will be able to perform it without pain or with less pain. Okay? So let's first see the power. If I'm right here, we have to go under the deltoid muscle. Do you feel the ultrasound?
Yes.
Yeah? Okay. But when I go right here, I have to lower it maybe a little bit because there's not a thick portion of tissue. We have the muscle down there, so I can lower it a little bit, and maybe 2.5, 2.4 watts per centimeter square. It's okay with this?
Now it's okay.
Okay. And as I said before, when I'm treating the tendon, I can stay here, I can go in front and treat it, and the patient, of course, may stand still. I'm just performing my rotating movements, and then when I'm here, I'm asking him to do a little bit of flexion, like this, and to come down. Repeat. Okay. And I can continue working. Of course, in this case, the patient doesn't have a lot of problems, so if I want, I can ask to go even further. But if you have a problem, a patient with pain performing flexion, you can ask to lower the movement a little bit. Okay, another movement you can ask from here to go this direction. Often another movement that causes a lot of pain. And you can go here in the supraspinatus muscle. Okay, you can follow it. And then you can go right under the scapula. You know that here we have the infraspinatus and teres minor. They're really exposed by the movement. So when you perform this, do it again. Okay, stand still. When you perform this, the muscle is really exposed, and you can treat it really easily. You just set it here. You can always ask the patient to maintain a certain position if you want to treat it, or to perform the movement. The important thing is that you don't stand still, but you continue your circular movements and the treatment. Okay. Okay, now we're going to take a look at epicondylitis, a very common pathology, especially if you work with sport athletes. We can remove this to use a fixed type of emission, in this case, because we want to apply the headpiece directly on the bone for the first part of the treatment, with each fixed, and then we can use a movement part of the treatment for the muscles. We know brachioradialis and the most important muscles of the epicondylitis. So in this case, we're going to use this to adjust the headpiece perfectly on the patient. Okay. Okay. Then we're going to apply the cream. It's important to use a little bit more of cream because you want to protect the patient. In this case, we have a static application. We don't have movement. Okay. Once you have a good positioning of the patient, we do the setting. Okay, in this case, when you're doing a fixed kind of therapy, you're not going to use a continuous emission, but you want to choose a syncopated or pellicular emission. In this case, we're going to choose a syncopated emission. Then you set the cryotherapy. Also, because there is no movement, it's important to set the temperature at 5 degrees or more, up to 10 degrees. It depends, of course, on the clinical reasoning that you're applying, on the assessment that you're doing to your patient. So if he has, of course, we said before, a lot of fat, of thickness of the skin, okay? So you're gonna decide, in this case, we stay a little bit higher with the temperature because our patient is really skinny and is thin. So we go to 5 degrees. The time setting, in this case, we can set to 10 minutes, 8 minutes, because it's very localized treatment. Let's say 8 minutes, so I always add 2 minutes, and I select 10. Okay. I always hear the beep, and then we start with the emission. Of course, same clinical reasoning. If you have an acute stage of the pathology or a chronic stage, you can choose with the power of the ultrasound. And of course, if you're static or in movement, it's a little bit different. If in this case you're static, you're not gonna choose a very, very high power of ultrasound. So you may start at 1.5 up to 2. And then, of course, it's always important to have the feedback of the patient, always. Then after the treatment, you can go, as we saw before, to a dynamic treatment of the muscles involved. So in this case, let's say I finished my static treatment. I can take the headpiece out of the arm here. Okay. I can set a continuous, in this case, emission of the ultrasound. As we said before, we can lower a little bit the temperature because now it will be a continuous emission and a movement emission. So let's say 2 degrees. We set 0 to 2 degrees. It's okay because of the clinical reasoning we said before. we set time, and we can set, the part of course is not big, so we can set a little bit under the time that we usually see. If we want to treat 10 minutes, you can always add 2 minutes to allow the machine to reach the selected temperature. In this case, my choose with the power will be greater, so I will start with 3 VATs per centimeter square. If the patient feels any discomfort, I can always lower it down. And of course, the movement is always the same. I support the weight of the head with my shoulder, so I do not make any effort. And of course, always circular, slow movements. Okay, now we're going to take a look at another very, very common pathology, which is the Achilles tendinopathy, so problems with the Achilles tendon. This is very, very common problem in running athletes, in tennis players, football players, so very, very common. And it's also an inflammation that we usually see in a chronic stage. So, as we said before, for a chronic stage, we will prefer a continuous emission and a movement therapy. Let's see it. Okay, in this case, I don't need the arm, I may need the shaft, so I can use it to support the headpiece. And as you can see it, when I treat my Achilles tendon with the shaft, I do really no fatigue, and it's really, really easy. One tip, one advice for the treatment of the Achilles tendon. You may think that the better way to treat the Achilles tendon is right here, because it's the most common place to treat it. Actually, with the Cryo-Ultrasound, we prefer to divide the treatment into 2 parts, with a little bit on the medial side and the other half of the treatment here on the lateral side. This is because with the cream we can have a better suitable position for the head and for the tendon. So it's better, it's an advice to treat it half here and half on the medial side. It's really better, more comfortable to the patient and more effective for you. Of course, you can do it static if you like. You can do static here and static here. I prefer to go on a continuous emission and in movement, because I like to treat the 2 parts that I explained to you and a little bit the proximal part of the Achilles tendon. And if you like, you can go, of course, treating the gastrocnemius as we saw previously in other videos. So you can go up to the gastrocnemius. But if you like to concentrate on the Achilles tendon, you can go from here to here in continuous mode, or you can do fix it here and here, half treatment, half treatment. So let's talk about the setting. As I said, I will perform a continuous emission therapy. So I will say continuous. Because I'm going continuous, I can set the temperature at 2 degrees out low, as we saw before. So in this case, you have always to think, and of course to ask the patient, but also to assess, to think, and the clinical reasoning is really important. So in this case, not a fat patient, we have a thin person. We don't have a lot of calf muscle, so we can use at 1 degree, 0 degrees. I will not go down, but of course it's your choice. So 1 degree, set the time. With the time setting on tendons, it's really important to remember that tendons are a little bit more responsive than muscles on the therapy. So you will not do usually 15 minutes of treatment on the tendon, you will do usually 10. So if you think about what we were saying before, with the static treatment, you can go 5 minutes on this side and 5 minutes on the other. This is the most common way to proceed. So in the dynamic treatment as well, I'm going to put 10 minutes. So as we said before, we put 12. So we give time to the device to set. And I can go down and press start. Of course, I hear the beep sound. We can go really, really high in this case because it's a chronic disease. So we know that we can go with a good power and will not harm the patient because we have 1 degree of cryotherapy that protects us. So I will do it on the medial side first. If it's better for you, you can always ask the patient to turn a little bit, and it's really easy to treat it this way. Does it feel okay, Luigi? Okay? If it's too much, if the patient is not comfortable with your choice, you can always lower it down a little bit the energy, and you will do 5 to 6 minutes on this side. I like to go, as I said before, up to this point where the Achilles tendon ends and there is the muscle junction with the calf muscle, with the gastrocnemius, and down here where the inflammation always does a little bit of pain. And then after 5 to 6 minutes, I will turn a little bit the leg and do the other side. Same clinical reasoning. I will do it this way, comprehend the tendon and go up, maybe a little bit less, perfect. And you go up and down, always circle movements. I do not feel any pressure, any weight of the head because I'm using the rod. Circular movements, very slow, and there you go. Okay, so now we'll see this detail on the tendon. Try to avoid, if it's possible, the superior part of the tendon because it can be a little bit of discomfort for the patient and you will not have a good contact point with the headpiece, okay? So you try to turn the leg a little bit and have a good contact point on the lateral side of the tendon. Of course, I'm doing it in a dynamic mode and I try to avoid this part right here. And then the same thing as I turn the leg to do the medial side, I try, I don't know, maybe you don't see it right away, but I'm trying to avoid the superior part of the tendon and I'm doing the medial side. Of course, it's the ankle is a little bit here the problem because you can touch the tibia, okay? So you don't want to treat the tibia, of course, you're going to treat the tendon. And if you overlap a little bit of the tendon, it's not a problem. But try to avoid the superior part to have a good contact point on the tendon. Same thing, if you do aesthetic treatment, you're going to push the arm right here and you want to set a temperature a little bit higher. So you're going to treat to 5, 6, even 7 degrees. You're going to put here, you're going to avoid this little part here. And of course, you make sure that the patient doesn't feel any discomfort by the cold. And you can do the therapy for, let's say, 10 minutes, because it's 4 minutes per each side, and 2 minutes more, as we said before. Okay, now I'm going to show you a little tip on another very common situation, which is the operation, so the surgeon on the ACL, so anterior cruciate ligament. We know that for the ACL, there are mainly used 2 tendons for the reconstructive part of the ligament, of course, and they are gracilis and semitendinosus muscle tendons. In this case, that are detached for the insertion in the pes anserinus of the tibia, and they are used to, of course, the reconstructive part of the surgery. Okay, so in my experience, when a football player or a person who has been in surgery for an ACL problem comes to the clinic, it's really difficult at first to manage the mobilization, and it can be, you can have swelling, you can have pain here because they detach the tendon, and of course you will have swelling on the posterior part of the knee. So what can you do? You can of course apply high specs, but of course with CryoUltrasound you have the cryotherapy that you can set at a certain temperature and stays at the same temperature for all the duration of the treatment. So it's very, very good. And you can use it in this part, of course, where the tendons are, to lower the inflammation. and to reduce the swelling. This allows you to have a faster recovery and to apply your manual therapies, your mobilization even faster and before that you normally would. Okay, so as always, you're gonna set your parameters. In this case, I prefer, is my experience, of course you can change it, but I prefer to do a continuous treatment because, of course, you know that the tendons are in this part of the pes anserinus, but the muscles runs up here for the semitendinosus and up here for the gracilis. So really long muscles. Of course, you don't have to treat all the muscle, but you want to treat the area, and I, for myself, prefer a continuous way of treatment. Okay, so before we set with, in this case, a continuous way. Of course, you can always do a syncopated or pellicular treatment if you're going to leave the headpiece in the zone with a static treatment. In this case, we're going to set cryotherapy. In this case, you have to be very careful with cryotherapy because, of course, the swelling creates a lot of inflammation and the patient may feel a little bit of discomfort with very low temperatures. So if this happens, at first you can start with 2, 3, 4 degrees. There's no problem. The patient does have to feel good, does not feel any discomfort, of course. So you start maybe with 3, with 4, and then if it's okay, you lower it, okay? So in this case, for my personal experience, I will start a little bit higher because the pain and the swelling, and then we set the time. It's a pretty big portion to treat, so I will set, as we said before, 15 minutes of treatment. We add 2 minutes to allow the machine to work, so it's 17 to reach a good temperature. Okay, we will not have to put a lot of watts per centimeter square in this case, because if there's been a surgery in the first days, you're not going to use a lot of power, of course. So you can stay between 1.5, between 2 watts per centimeter square. And then as the therapy proceeds and you go over, you can, of course, rise a little bit with your power and change a little bit the parameters. Okay. So in this case, I prefer to work with this on my shoulder because I can reach the part and really be on the zone, and I can work and treat and use my hands. But if you prefer, of course, you can use the rod. There's no problem. Just be sure that you're good, you don't feel any pain, any discomfort, and the patient is good. Is it good, the ultrasound? Good? Yes. Yeah? If it's too cold, if the patient says he feels too cold on the zone, you can always change a little bit the temperature, you know. So you're going to stay here. This is the part that is treated most with the surgery. So in this medial side, remember always the medial side of the knee, where the tendons are, you will have the most of the swelling. You can go a little bit up, as I was saying before. You can go down. Of course, beware, here we have the vessels and the nerve, and they are very, very superficial. So we have the artery, the vein, and the nerve, and we don't want to stay a lot of time without moving on this part, the central part here. So we're going to put a little bit on the medial side, always moving, rotator movements, very slow. And this is just your therapy and your movements for this kind of approach. Okay, now let's see a very, very common injury, which is the hamstring injury. This is by far the most common injury in football players, but also in normal patients you will see it. With Cryo-Ultrasound, we can treat it right in the first days. Even in the first day, even in the day of the injury, we can treat it because we use cryotherapy and we use ultrasound, and we are fast to recovery, and we are treating the muscle properly without any thermal effect. Okay, so in this case, you will see a patient with an injury, and we have to know which grade of injury we are, because you know there's a grade 1, grade 2, grade 3, and every stage has different problems, okay? Let's see in this case, maybe the most common are between 1 and grade 2, so we'll see things like that. Normally, the most common muscle is the biceps femoris, which you know runs from here down to the fibula and to the knee. So it follows these patterns, and normally the most common location is the myofascial junction in this case, so between the muscle and the tendon, or down here, same thing, from the muscle to the tendon, okay? So we'll have this zone to treat. Because it's a really big zone, we will maybe prefer a continuous treatment application. I think it's better, but of course, if you have a very small injury and you want to treat directly without movement in a static treatment, you can do it, of course. It's your choice. One really useful tip that I can give you based on the experience with Cryo-Ultrasound is that often muscle injuries are in a very good depth of 2 to 3 centimeters. So it's really tough to reach with normal devices. With Cryo-Ultrasound you can, because you can set the power of the ultrasound really high and use the cryotherapy to protect the patient and to protect the tissue, okay? Because of the nature of the injury, you will have the leg to be a little bit flexed. So we in this case, we put a pillow under the leg of the patient to make him comfortable. And another thing that I can tell you is that I usually do this treatment twice per day in the first days, because when we are in acute situation, you can use it twice per day without any problems. And of course, we always have the cryotherapy that protects us and that helps us a lot doing this. So let's see in practice. Okay, in this case, of course, the modality can change. We can use a continuous emission and the movement. If you place the head piece still, you will prefer maybe a syncopated or a pellicular type of emission, okay? Also, if it's really the first day of injury, maybe you will not prefer the continuous emission, even if you have the cold, the cryotherapy to protect you, because of course, you know, in the muscle lesion, we have to be careful the first days. So let's say that Luigi came to me with a muscle problem. Okay, yesterday he felt a little bit of pain right here, so I can put continuous or pellicular mode without any problems. I will set the temperature. In this case, it's a really thick muscle, really big, so we can go below 0. Of course, it changes a little bit. With Luigi's leg, maybe 0 to -1 is good. If you have a rugby player, of course, very thick leg, thick muscles, you can go to -2, -3 without problems. If you have an elderly, so older patient that has a similar injury, similar strain, maybe you will not go below 0. That is, of course, your choice, and it's based on your experience and your knowledge. So I will say, in this case, we go -1 Celsius degrees, because we have to protect the tissues really in a good depth, because as I said, the injury always happens at 2-3 centimeters, okay? So we set the time. In this case, we have a continuous motion with the treatment, so I will set 15 minutes +2 to give time to the device to reach the temperature that I selected. In this case, I'm told, so I usually prefer to make this run through my shoulder so I don't feel any fatigue, and it's really easy to me. But if you prefer, you can use this, the rod, the shaft. You can do it this way, and same thing, as you see, it's really light, and you don't make really any effort to work if you use that. It's a really good tip to work properly, okay?
So we use, as always, deconductive cream to help the conduction of cold. Spread it a little bit, and then make start. And we're going to start the treatment. We hear the beep. We can set, in this case, a really high, as I said before, a really high force, even to 3 watts per centimeter square. Luigi, do you feel the buzzing a little bit? Yeah. If Luigi feels a little bit of tickling, a little bit of pain in the zone, we can lower it a little bit, okay? We can bring it to 2.5, 2.7. It's okay now?
No,
yeah? Okay. So now it doesn't have any discomfort, and we can work properly. The temperature is already going down, so it's good for our practice that the temperature is down, so the ultrasound won't cause any problem. And if my lesion, my muscle lesion is here, I will go with round circle movements in this zone. Of course, I can go a little bit up because, you know, the tendon is right here. And it attached to the tibia, to the ischial tuberosity. So you can go up there and then to the muscle and then down. Of course, it depends on your assessment, on your experience. You have to touch, you have to feel the skin, to feel the muscle of the patient, to feel where the lesion is. Maybe you will have, of course, exams and a better location of the injury itself. And then you can work properly with these movements in the zone. When we have a later stage in the therapy, let's say Luigi is better, and we can start with a little bit of exercise. We know how important is exercise in the rehabilitation. So maybe while I do this, Luigi can lift the leg up and take it down and continue the movement. So we are activating his biceps femoris as I'm treating him. And with the cryotherapy, it doesn't feel any pain doing this. And we can start really fast recovery with movement.
Okay, so this is the end of this first webinar. I hope you like it. I really loved to share my personal experience. I hope it's useful for you. Of course, the Medisport Academy is here for you. So if you have any doubt, if you want to have more details, we will see in other webinars, but you'll always have a way to contact us and to ask us more. Of course, we will see more about Cryo-Ultrasound. I hope today was good, but we will see more of the pathologies you can treat with Cryo-Ultrasound, and we will see all the other medical devices by Medisport and how to use it and what advantages can bring to your daily practice, okay? So I thank you very much. I thank Luigi, my model for today, and see you soon. Bye-bye.